We humans have a complicated relationship with medicine. We crave quick fixes, often seeking immediate relief without fully understanding the consequences. We want solutions even for things we barely understand, and this impatience can sometimes lead to dire outcomes. This desire has at times led us down some pretty dark paths. Take lobotomies, for instance, a procedure that was once widely accepted. This gruesome procedure, once hailed as a miracle cure for mental illness, involved severing connections in the brain, often with devastating results. It left countless individuals permanently damaged, their lives irrevocably altered. With hindsight, the practice seems barbaric, almost unbelievable, a stark contrast to today's medical standards. But it serves as a stark reminder. Just because something is considered medically acceptable in one era doesn't mean it's safe or effective. We must always question and strive for better. Fast forward to today, and we find ourselves grappling with another complex medical frontier: gender-affirming care. This evolving field is at the intersection of medicine, psychology, and social science, aiming to support individuals in aligning their physical appearance with their gender identity. This term encompasses a range of treatments and procedures for individuals experiencing gender dysphoria, a condition where there is a conflict between a person's physical or assigned gender and the gender with which they identify. These can include hormone blockers, cross-sex hormones, and various surgical interventions, each tailored to the unique needs of the individual. Supporters argue these treatments are life-saving, offering relief from debilitating distress and significantly improving quality of life. The use of puberty blockers in adolescence is particularly controversial, sparking debates among medical professionals, parents, and policymakers. These drugs essentially hit the pause button on puberty, suppressing the development of secondary sex characteristics and providing time for the individual to explore their gender identity. While presented as a reversible intervention, the long-term effects of interrupting this crucial developmental stage remain largely unknown, raising important questions for future research. Advocates often claim that hormone blockers simply provide time for young people to explore their gender identity, giving them a pause to make more informed decisions about their future. But delaying puberty comes with its own set of potential consequences, which are not always fully understood or communicated. Bones may not reach peak density, potentially increasing the risk of fractures later in life, which can have long-term health implications. Fertility can be impacted, sometimes irreversibly, affecting the ability to have biological children in the future, and the impact on brain development, a process intimately intertwined with puberty, is far from fully understood, raising concerns about cognitive and emotional growth. Adding to the complexity, some individuals who underwent gender-affirming treatments are now expressing regret, questioning their past decisions. They report feeling pressured, rushed, or inadequately informed about the potential long-term consequences, which can lead to significant emotional distress. Their stories highlight the deeply personal and often agonizing nature of these decisions, emphasizing the need for comprehensive counseling and support. And I felt like I was a problem to be solved, says Chloe, who transitioned in her early 20s and later detransitioned. I was told hormones were the answer, but they didn't address the underlying issues. Chloe's story, while just one among many, underscores the need for caution and thorough evaluation in these cases. Medical professionals have a responsibility to ensure patients are fully informed, not just about the potential benefits, but also about the potential risks and unknowns.